we need to review the most important part of the consult with the patient. Outside of the patient's name, the validation of the patient's insurance needs to be covered. Okay? So once the insurance is pulled and you have that information on your screen, you need to verify with that patient that A, it is their name that's on the card, not their spouse's, whose name is on that card, spelling and everything. Okay? Then you need to go over and make sure that the member ID is correct. The member ID must reflect their current insurance. We're seeing too much of these transfers to where member ID is being kicked back because the insurance is no longer the one that they're carrying. The BIN number, okay? When you're confirming a patient's insurance, the BIN number is the primary target of collecting that information. Without the BIN number, we cannot process a prescription for them, okay? So regardless of the method of pulling that insurance, okay, if you use zeros, that BIN number has to be in there. Upon transfer, it has to be placed into that patient's portal. Okay? Without the BIN number, it's a completely dead deal. Okay? Also, the BIN number has to reflect their current carrier. Okay? We're having too much to where we're receiving a transfer where the system's showing that they're carrying Blue Cross Blue Shield, but yet it's really Aetna. That they're carrying Caremark, but it's really Humana. It needs to be fixed, because what's happening is there's just too many kickbacks from pharmacy once it's in processing, saying that it's unable to process due to insufficient data. Okay? And it's either because the BIN number's missing or because it's not the correct member number or BIN number reflecting that patient's coverage. Okay? So, you know, once you have that patient's information, regardless of how you pulled their insurance, you still have to verify that with that patient. Okay, I'm showing here that you have Blue Cross and Blue Shield member number HH49245. Is that what you're showing on your card? You have to verify that. Okay? You have to. If they don't have their card, ask them to confirm the last four of their social and re-pull the insurance to see if the same information comes back for them. If it does, ask them, well, hey, is your current carrier Blue Cross and Blue Shield? If they tell you no, it's Aetna, you have to wait until they have their card to change that information in the system. That's not a deal. Okay, so there's no need to process something over or push something over that has insufficient data on it. It's a false read, it's a false sale. Okay, so, you know, in doing the job, you know, you need to ensure that you're asking the patients all relevant information. That they are the ones that are experiencing the pain. A spouse cannot speak for their spouse unless they have a medical power of attorney. Individuals being married does not place a power of attorney over the next individual. It has to be a legal power of attorney to engage in any kind of medical terminology as far as making decisions for another individual. It has to be done. Okay? So, in the process, name on the card, member ID, and the BIN number match. That is what is showing in this system and on file. It has to be done. It has to be done. You know, so when everyone's wanting to know, well, what happened with these 15 patients, and they were all kicked back from pharmacy processing due to lack of information or wrong information, data discrepancy, showing that that patient, that Blue Cross and Blue Shield is not existent right now. Okay? Because they might have had that 5 years ago, but now they have Cigna. That's what they're using, but they haven't actually used it yet. So it's not showing in this system. So you have to validate that the insurance that you're seeing in that system is in fact what they do have as a carrier and as a card. All right, guys?